A big hello and welcome to everyone listening today. We have the delight of another exclusive webinar. This time, we are extremely excited to hear about the launch of the L&D's brand new robotic assisted surgery program. The specialist robots will be used across a variety of different specialities, treating patients with conditions including bowel and renal cancer to endometriosis and other gynae conditions. Mr. Montassa Maran and Mildred Delanta, who are part of our strong team at Bedfordshire Hospitals, have a wealth of knowledge behind them. They are both highly qualified, experienced and well respected in the gynae field, specialising in endometriosis. They have been kind enough to agree to present today this exciting new addition to their way of working. So Mr. Maran, over to you.
Well, thank you very much for this nice introduction, which is very, very important part of the awareness about endometriosis and the recent advances that Bedfordshire Hospital is delivering to the local population. And it's very important to share this information with our patients. I'm just going to share my screen. Is that clear now? You can see it. That's brilliant.
Yeah.
So, my name is Montassa Maran. I've been a consultant in Bedfordshire Hospital for almost 11 years. My main interest is oncology and endometriosis, and now I'm covering the endometriosis service across Bedford and Luton Hospital. And as I mentioned, it's a great opportunity to talk about what are we delivering and why we are delivering it. Now, the objective of the talk today is to answer the common questions that most patients or most women will need some clarification or will be asking most of them, and also to elaborate about the new service that we are delivering to our local population, which is a very high standard quality of care service. Now, the commonest question that most women would like to know about or would like to answer, some answers or clarification is what is endometriosis, why it is very important, and how can we diagnose that, and also how we can treat it. What is the time to see a specialist and when to see an endometriosis center, and what are the surgical options that are available for you, and why do we need a robot in this surgical field, and how you can access our services. I try to make it very simple, easy presentation. So we start to understand more about why the robot is very important. It's very important to understand why we need to understand about endometriosis. So going to the basic, what is endometriosis? If you can see that if we look into any female from one side, we'll find that this is the uterus, and underneath is the vagina. In front of them, there is the bladder, and at the back is the bowel, and that's the opening. And you have some bone at the back, and the rest of the bowel is here, and that's the opening. The lining of the womb, called endometrium, which is here. That is the skin that get shed or get the bleeding every month and form the period. So sometimes that skin can be inside the abdomen or inside the pelvis, like all these nodules that we can see it. So during that time of the month, the patient can bleed from the endometrium, which is the normal period, and at the same time, they can bleed inside. The bleeding inside can cause pain and can cause scarring and can cause lots of other symptoms, like pain during opening your bowel, pain when you pass urine, pain during intercourse. It's very important to know that this endometriosis or this skin can be close to a very important structure, like bowel, nerve, blood vessels, bladder, ureters, top of the vagina. So that's why it's very important, if we want to get that endometriosis out, not to affect the structure around them. Now, having some ideas about endometriosis, Now, this is endometriosis. This is inside the abdomen, and you can see this dark dots are endometriosis. So this is what get engorged and inflamed every month, and they bleed inside, and you can see around them, they start to cause some scarring. Nobody can know actually how deep this endometriosis is in. So it can be just a few millimeters, or it can be just the tip of the iceberg and going very deep inside the tissue, up to the nerve and up to the vessels. This is a normal female pelvis to some extent, and you can see that's the uterus, that's the tube here, and that's the ovaries, and that's the rest of the tube, and the rest of the bowel here. You can see this is the rectum here, and you can see there's a big space. That's a normal female pelvis with some superficial endometriosis, some spots of endometriosis here and there. We can diagnose this with a very good technology, with a very good camera, and with the trained eyes. So you can see it because we have a good camera here. If you don't have a good camera, you can actually fail to diagnose that. So having a good camera is very important to see all these small spots. You can see here, this is very simple and very healthy tissue. But this area is look like a scarred area from the endometriosis. And this is an early stage. When we move to this slide, you can see the uterus is there, and you can see the bowel start to get stuck to the uterus and the ovary stuck. You can see that's the difference between this one and this one. And then moving to the more advanced stage, which is uterus, bowel, and you can't see anything in between. It seems that everything is glued together with a sticky layer. That's very, very advanced endometriosis. And this one can be advanced as well. But you can see the difference between an open pelvis to a glued pelvis or very stage endometriosis. And that tells you that there's a different stage of endometriosis from stage 1 to 4, or recently we use another classification called NCN classification. So why it's very important? Well, it's very important because it affects about 10% of women. And it can take up to 7 years to diagnose the problem. This has significant impact on the physical health, emotional health, daily activity, loss of earning, fertility problems. For a long time, we've been saying that it's about 10%. But I think, that's my personal opinion, that it's underreported. Most likely it's more than 10%. Because with the new advances, and with the new imaging and the new pictures and the new technology we have in the surgical field, we can diagnose more and more endometriosis. And we understand more about it. And we understand the typical presentation, the atypical presentation, and the different looking of the endometriosis, which we can actually see it when you have a better technology. So how we diagnose it, the most important thing is to take proper history. Usually women will present to the clinic and they have pain, they have chronic pain. We usually start to give them some sort of contraception at the beginning, like progestogen or contraceptive pills. And if they are feeling better, most likely they have some sort of gynecology problem. One of them can be an endometriosis. The most important is, and this is what I tell all my patients, that if someone come, and even my registrar, if someone coming to your clinic saying, I have pain, it means they have pain. We also encourage our doctors, and especially with the new awareness about endometriosis, not to ignore or dismiss the pain that women go through. But when that happens, it takes 7 years to diagnose it. Now, very, very important that ultrasound scan can diagnose an ovarian cyst or can diagnose an adenomyosis. Having an ultrasound scan can help you to diagnose those two problems, but it's not highly sensitive in diagnosis all kinds of endometriosis. Mainly because it can't see every single layer of thin tissue of endometriosis, and also not everyone is trained in getting the right imaging or the skills of few signs that we can find on the scan. Now, MRI scan, the same thing, but we need to request an MRI scan if we think there is a deep infiltrating. So if we think that the endometriosis is going into the tissue, then there is a place for the MRI scan, especially if it's in the bowel. And it will help us to plan what we need to do during surgery, whether we need cut a small part of the bowel or just only shave it, but that's not the topic of the day. The topic of the day is that, yes, MRI scan has a significant place, but it depends on the training and it depends on how it is going to help with the management. And most of the gynecologists will agree that until now that the gold standard is laparoscopy and histology to take the tissue and diagnose it. And you can see that the cornerstone of diagnosing the endometriosis is to be aware of it and to be aware that it exists and also to start the initial investigation. Now, how we treat it? We treat the endometriosis, we mainly treat the symptomatic women. So not every patient or every woman with endometriosis needs surgery or need treatment. If it's not causing problem, then we can leave it. But if it starts causing problem, that's the time that we need to interfere. We start with the medical management, like hormonal treatment or painkiller. But if that didn't work, then we go to the surgical option. The surgical option is actually most of the surgeon will do it laparoscopically. And there is a big discussion whether doing ablation and excision, and lots of studies going around about ablation and excision, but most of the advanced laparoscopic endometriosis surgeon will prefer the excision because you can get most of the disease out. However, the excision or ablation, you have to be very careful about what we are excising because the endometriosis can be on top of the ureter, on top of the bladder, on top of the rectum, with very important nerves around it. So we need to be very precise in the cutting and very precise in the excision. And I'm trying to highlight this fact because this is what will take us to our robotic surgery. What we do during the surgery is removing the uterus, which is hysterectomy, and that can be very useful in adenomyosis, which is the lining of the womb is inside the wall itself of the uterus, or removing the ovaries, like what we call it oophorectomy, or removing the ovarian cyst, which is chocolate cyst or cystectomy. I need to stop here for a few minutes because the recent evidence saying that removing this chocolate cyst from the ovary can affect the ovarian reserve. So every woman is born with limited numbers of eggs in their ovary. If we try to do surgery on the ovary, it will reduce the ovarian reserve. So a good technique and less bleeding and having good surgical plane will enable us to preserve as much as possible from the ovarian reserve, which means will help with the fertility outcome. Now, why it's very important to diagnose the endometriosis accurately and to treat it accurately? Because if you have a proper diagnosis with a proper MRI scan and a proper MDT meeting and a proper team around you, you can offer the proper surgical intervention. So it's not about doing surgery for endometriosis. It's about doing the right surgery for the patient's circumstances to be able to meet their objectives. So not everyone should have a hysterectomy. Not everyone should have their ovaries out. Not everyone should have an excision. Not everyone should have the endometrium out. It depends on what they need and what they are suffering with. So if you accurately diagnose that, then you can actually give them the best surgical option. If you miss the diagnosis, then what it will end by, you have a patient who will suffer. And the problem is if you don't have the more advanced technology, or if there is poor camera imaging, then you can easily misdiagnose endometriosis, or if you don't have well-trained eyes, you can misdiagnose that. Which means the patient will be told that you don't have an endometriosis. and they will suffer with it for years and years and years and years, and will start going around and around with a bowel surgeon, urinary problems, pain clinic, because the camera was not appropriate camera at the beginning. And which means we need to help our patient to avoid the chronic pelvic pain. If we have a proper diagnosis and proper surgical planning and good equipment, then we can reduce the complication rate. If you know exactly where we're going surgically, then less risk of injury to the ureter or to the bladder or to the bowel, and even less risk of having stoma or leakage of the bowel resection, and less risk of adhesions, which can cause complication later on. And that all can be translated into a successful surgery and improve the quality of life of the patient. So it's very important not only to diagnose the endometriosis, because endometriosis itself now in 2023, despite that it's a challenging medical question to some of us, but we start to understand more about it, and there is lots of surgical option and lots of training going around, and lots of new generation has been trained in it, and lots of conferences about endometriosis. So, and the government is supporting that in lots of movement, especially with the support of Endometriosis UK. Now, and that's the idea of the Endometriosis Center. Now, in UK now, there is 77 endometriosis approved centers. One of them is the one we have in Luton, which is Bedfordshire Endometriosis Center. And what's the idea of the Endometriosis Center is to have an expertise in the field, which involves a gynecologist, endometriosis nurse, and we have Mildred with us on the call today, who actually looks after all our endometriosis patients. We have a trained colorectal surgeon who is trained in endometriosis of the bowel. And this is a very high technical surgical techniques, in addition to a urologist, which is trained in bladder and ureter problems of endometriosis. And the cornerstones for the service is radiologist. We have Dr. Rashna, who is outstanding or in telling us where is the endometriosis before we go into have a complex endometriosis surgery. And without the help of the radiologist, we'll never be able to achieve the optimum clearance of endometriosis, and it can be easily get missed. I mean, if we talk about endometriosis, we have to talk about the pain associated with it. That's why we should have pain management team, which we have it as well, and refer our patient to them. And all this is very important to be collected in the data, because data will help us to understand more about our figures, help moving forward, and understand nationally how we can improve the care and what's the optimum treatment. Now we're coming to the surgical approach, which is the focus of the topic of the day, which is laparoscopy. Laparoscopy, it's been invented 30 years ago. It's every hospital has a laparoscopic surgeon. The new advance in laparoscopy is robotic surgery, which in fact a laparoscopy, but with a robot. And I'll show you some pictures and videos about this now. Open surgery is rarely done nowadays, except if you have unless there's a big fibroid or any previous lots of adhesions inside the abdomen. However, the more advanced you have and the more training the surgeon you have, the less risk to convert to an open surgery. Now, the surgical approach is, as we mentioned, removing the cyst, removing the ovaries, removing the womb, ablation or excision, and treat the bowel endometriosis and bladder endometriosis. Now, this is very important slide. Why do we do surgery? The aim of our surgery is to go inside the pelvis and to remove all the endometriosis. And it's not only about removing the endometriosis, it's about removing the endometriosis without damaging the structure around it. And to be able to do that, you need a good image, you need to have good training, you need to have good surgical field so you can see quite well where you're going. And you need to have good psychomotor skills. Psychomotor skills is well known in the surgical field. Good hands, good training, a steady hand. So when you start cutting close to the ureter or close to the nerve, you don't accidentally cut the nerve. In addition to that, you need lots of assistant with you. You need someone who's trained to be assistant to hold the camera. The other very important thing is the peak of the surgical performance. As human, we prefer to do the complex endometriosis surgery early in the morning, while the surgeon has the peak of the performance. If I have 4 hours to 7 hours surgery with a bowel surgeon, I'd rather do it in the morning, not at 3 or 4 o'clock in the afternoon. And end of the day, you need the whole team to help you. And as I mentioned, is that having a good plane, good surgical technique will reduce the complication, will reduce the scarring, and actually will help in the ovarian preserve and less risk of ovarian damage. Now, this is the evolution of the surgery. All days, the surgeon stand, cut the abdomen, and go in and do an open surgery. Then the advance in laparoscopy, the surgeon stand straight back and put small cut in the abdomen and look to the screen. And standing like this for 3-4 hours, you get tired. You get very, very tense back pain. Can you imagine? And you forget yourself that you've been standing like this for 3-4 hours. Neck pain, shoulder pain, back pain, and then that affects your performance. So if you start at 9 o'clock, it's different. And you carry on like this and you find that at 3 o'clock, you're tired. And this is where your performance starts to reduce a little bit. The new advance, which is the robot, is what we do is we replace this person by a machine, and we give the device to the machine, and we move the machine while you're sitting there. And that's the robotic surgery. When we introduced the robot to the hospital, the patient thought that the machine is the one who will be doing the surgery. No, it's not the machine. It's not Doctor Who will be coming to do the surgery for you. It's I am doing the surgery, but I am moving the device with a very, very precise movement to get the surgery done. Now, starting with the robotic surgery, it was invented 30 years ago, and that's the surgeon standing there, and this is the instrument that we use, and that's go inside the abdomen. And it is actually very, very advanced technology, and there is lots of advance in laparoscopic surgery now. There is very good imaging, there is 4K imaging, there's 3D imaging, and it's fascinating what we can have in theater, because all this will enable us to diagnose, see more structure, see more endometriosis, so we don't undertreat and we don't overtreat as well. And with more training, you have less blood loss, less hernia, shorter hospital stay, less pain, better cosmosis, and early return to work. And that's why we prefer the minimal access surgery approach. What we happen now is we replaced the surgeon with the robot. Now, I'm going to show you a small video, and it's not about surgery, it's about surgeon doing a minor surgery for a grape. And it shows you the precise movement of the robot and how can the robot achieve the maximum surgical clearance without damaging the surrounding organs. That's why it's very important to have it in the advanced endometriosis. I hope it will work. Is it working now?
Yeah, it's playing. You just need to maybe turn the volume up slightly on it. Okay, that's fine.
So just 1 minute video. I'm not taking much of your time. So this is the surgeon. and you can see that's the grape, and you can see the surgeon has three. That's the surgeon. He has two hands here, but inside the abdomen, he has three hands. 1, 2, and 3.
Wow.
That's fascinating.
Wow. Wow. That's incredible.
It's so precise, but also delicate as well.
It is, and it's very, very important, because in real patient, I'm trying to avoid putting patients' videos with blood and with flesh in it. It's very precise. You can see the nerves, the blood vessels, the muscles clearly. So if I go now.
Wow.
Yeah, I don't know how to, sorry. Share screen. Am I back now to the presentation?
Yes.
That's good.
Yeah, you're back now.
So that's the robot that this is the Da Vinci robot, and this is the most advanced technology in the market, in UK market. We've been privileged that we have this technology in Bedfordshire Hospital. And this is very important, that our patients need to know that their local hospital providing the advanced technology to the patient. So this is me on the robot, and that's the theater team, and that's the robot actually, and that's my assistant pushing the screen, and we can do the surgery. So why it's very important? Why the robot is very important? It's not only about the surgery. It has lots of advantage. Despite that, it does give you a very good surgical field. You feel that you are sitting inside the pelvis, inside the abdomen, and you can see all the structure around you, which means when you start cutting and you start to try to shave or get the endometriosis out, you don't need to over-treat and go close to the nerve of the bowel, or to go to open the ureter or the bladder. You can see all the layers clearly. So that will make optimum clearance as much as possible of the endometriosis. And it also avoid the complication. Now, if we compare the robotic learning curve to the laparoscopic learning curve, the laparoscopic is a little bit longer. So you need quite good few years to train a good laparoscopic surgeon to be able to achieve the maximum, or to be able to do a robotic, to be able to do endometriosis surgery. With the robot and with the new doctors coming now, who all of them are skills with the Xbox and computers, they have good psychomotor skills, which means their learning curve would be shorter. They can learn quicker and faster, and it means that the future is more promising, because we can train more doctors to provide more endometriosis work to the patient in the UK. Now, the endometriosis center is under significant pressure because there is limited numbers, limited surgeons trained in this field, but we need to train more. And that technology will help us to move forward. Now, when we do the robotic surgery, it's a 3D vision, and the robot itself, it can move 7 degrees of freedom, which means that you can do all the maneuvers inside the abdomen. It is well known what we call tremor filtration, which during the surgical cutting, the human hand will have some tremors. That does not exist in the robot. So it also helps in accuracy in cutting. Now, when I start as a consultant, I used to do like 3 to 4 hysterectomies laparoscopic a day. Now I am getting more senior, more experience, I can only do a day now, and otherwise I will get back pain. Now with the robot now, I can do more, which means will help more patient, less waiting, less time. So it does allow us to keep our surgical performance through all the day because you don't get tired. So you can do a difficult surgery in the morning and difficult surgery in the afternoon, and you can train other people. It's not difficult now with the robot to do a body mass index or BMI of 50 or 60 to do it robotically because it can be done. And the technology allows us to do this. In the past, it was a little bit challenging. And again, if I'm doing surgery for 4 to 7 hours, then to some extent, my surgical performance is almost the same through all that. What is very important as well is during the surgery, we fill the abdomen with gas so we can see better. With the robot, we don't have to achieve a very high maximum pressure. And that is translated into less pain following surgery and less shoulder pain and early return to activity. So in fact, the robot is surgeon-friendly and patient-friendly because it allows us to provide very good care to the patient. Now, this is a message from our team that I just want to deliver to all the patients of Bedfordshire, that you have a highly trained surgical multidisciplinary team in Bedfordshire Hospital, and we are committed to deliver excellent care to our patient. And this care is actually, it's up to the standard as any other unit in the country. So thank you very much for listening to me.
Wow. Thank you so much. That's just fantastic. Not only for yourselves, to help yourselves within surgery, but also, the fact that it will help patients with aftercare because you haven't got to have the stomachs as enlarged with the air from being more accurate. I mean, it's an incredible thing, and I'm very, very thankful that we have got such a thing at Luton Dunstable Hospital. It's very exciting, and I think all our patients who are at the hospital will be really, really excited about that news as well. So thank you so much for sharing that with us.
Well, it's
absolutely brilliant. Yeah.
And it's our job to bring all the new technology to our local hospital, and I think it's very, very important to keep moving forward. And we are training more people now on the robot, which is very good, very, very, very interesting, so we can help more patients.
It's fantastic. It's also, sorry to interrupt you there, Mr. Moran, but it's also fascinating from a point of, as Kat says, the gas going into the stomach. It's a long recovery from that. And a lot of women on the support groups post-surgery complain of, how do I get rid of it? It's a massive thing. I want to heal, but at the moment I'm just full of gas and it's so painful. And, there's loads of techniques to try, peppermint tea and things like that. But I think something that hasn't been touched on is endometriosis tends to grow back. So if you are doing something so precise, like we've watched the grape being peeled, so precise with no tremors, as you say, the chances of endometriosis growing back is much, much reduced because you've got to the core of it, if you like. You're right there, and it's much more precise. So the chances of women coming back into the endometriosis centre, laparoscopy after laparoscopy, is greatly reduced. I'm assuming from what we've seen this evening.
Well, it's a very, very valid point, and we know that in all the conferences of endometriosis we know that it is well known that the best surgery is the first surgery, because you go in, and if you have the advanced technology, you can see the endometriosis. And there is lots of technology in the robot which can make you see it better. And if you see it, you can excise it. And the maximum you excise, the better. I don't know and whether they're coming back, because most likely they go back definitely. But if you leave some behind, they can grow back. Yes, definitely. And the other thing is the scarring, because if if post-surgery patients start to develop scar inside, that itself can be another source of pain. So it's not only the endometriosis. So the more precise, the more clean field, the less risk of infection, the less risk of bleeding, all this contribute toward better care and less post-operative pain and complication. And
I think also, I mean, that's
no, please go ahead, Kathy.
sorry, I think there's a slight delay. Sorry. I think also, I just want to go back to something you said regarding fertility. Fertility is huge. Endometriosis is huge with it. I know a lot of people have to go through IVF, and so trying to eliminate that procedure is huge with this robotic surgery, due to the fact that you're saying that it reduces the possibility of losing the eggs because of the precision. All the women that are born with a certain amount of eggs are less likely to lose because it's less invasive, much more precise. So on account of that also is a massive bonus point for this robotic surgery, the precision and the skill. So the more people that we train for this, the better, because it's reducing not only with endometriosis clinics, but also from the fertility side of things as well. So I just think what you've shared tonight is absolutely groundbreaking, and cannot thank you enough to be able to put this out through Endometriosis UK. It's just incredible. Thank you, Mildred.
Well, thank you very much. And definitely, yes. I mean, any surgical work on the ovary will affect the ovarian reserve. So the good surgical technique will definitely reduce damage to the ovary. And we have to remember that we are talking about someone who wants to get pregnant, and every single tiny bit of the ovarian tissue is very, very important. So I think the surgical technique is very important. And this is also, I mean, there is no studies on this area now, because it's a new advanced technology, but common sense, it does help preserving the ovarian tissue and improve the outcome.
One other thing, Mr. Moran, is to actually praise you, and it has been said on previous webinars and before we go on to webinars, how much you've devoted to this. So I know that you have said that we have a dedicated team, and I know you're very much a team player, and you realise that the whole team is what is needed to help women with endometriosis and suffering of it. But I wanted to really kind of highlight how dedicated you have been, coming in very early in the morning, learning robots, working out how you get it to go where it needs to be, and all of that. That has been lost on myself and Kat, knowing that it's something that you've really dedicated. So again, a big thank you there. And Mildred, working behind the scenes, is absolutely fantastic. She does things that people don't even know about, double checking, making sure that if there's spots that she can put somebody into, she will do it. And then the backup that she has with you and the rest of the surgeons and the rest of the team is just such a great team to be part of. And the confidence that women seeing this, that are going through the Luton, Dunstable or Bedfordshire Trust hospitals, the confidence, I think, and security knowing that they've got this team behind them is really, really huge, and a massive thank you for that as well. I just wanted to highlight that, Kat. I hope that was okay.
Yeah, absolutely. Yes, we've heard about, you know, the countless hours that you've both sort of spent doing as well to learn with the robot, and I think, you know, that's a testament to what you also want to deliver, and how much you do care about your patients, which fits in very nicely with the slide. Obviously, you're saying you are committed to deliver excellent care to our patients, and this definitely kind of supports that wholeheartedly. So yes, from behalf of us and everyone that we support throughout Endometriosis UK, I think everyone will be internally grateful for all of that work. And, you know, ultimately you're going to really help so many people's lives. So I think that's really important.
That's very kind of you. It's a pleasure, and
So
that. Thank you.
Thank you.
Or Debs, we've lost your sound.
Are you? We lost. Can you hear me?
Yeah, I can
hear you. Yeah, so another thing for me to add as well, Kat and Debs, is we're very thankful for us to have a platform to raise awareness about endometriosis, and we're very happy that we're able to support you as well in giving this information to the patients. And we have a very good support team in L&D, and we're very, very proud of our team as well. So yeah, so we're very happy to to help in whatever way we can with our patients.
Pleasure, Alice. I just want to close.
I just want to thank.
Amazing. Thank you. Can everybody hear me?
Yeah.
Sorry, I just want to echo what everyone have mentioned. It's very important. It's very common problem, and unfortunately, lots of young ladies, they suffer with this problem. And by the time they get the diagnosis, they might have lost 7 years or 8 years or 10 years of highly energetic life. So the more awareness is there, we can help more patients. So it's you're doing a wonderful job. So thank you.
Oh, okay. No, that's fine. So am I still live and audible, Kat?
Yes, you are.
Good. Okay. So I just want to go into a little bit about Endometriosis UK. It's really just to sort of close up and finish through here. So please stay with us, Mr. Mohan and Mildred. It's really interesting information. So from a stats point of view, this will go out onto the Luton and Dunstable website. I think I'm right with that, Mildred, and Bedfordshire Trust, and then also onto Endometriosis UK as well. So I just want to mention something that's happening next week with Endometriosis UK. There is a real drive to push something called Match Fund. So all money that's raised with Endometriosis UK is being matched. Their target is £20,000, and what they're trying to do is gain some sort of more awareness and then be able to fund things like the robotic and surgery and things like that. So to help trying to get and etc. And trying to get waiting times down. So I'm just going to read out some of the stuff that they've said. So gynecology waiting times across the UK have soared by 60%, the biggest increase of any service. This leaves those suffering with endometriosis in silence, unable to access the care and treatment they need. Many are left unsupported with chronic pain and debilitating symptoms. The negative impact on their daily life, physical and mental health can be enormous. No one should have to go through their endometriosis journey alone. Certainly don't with Bedfordshire Hospital, that's for sure. Endometriosis UK provides vital support for the 1 in 10 with endometriosis through a helpline, a web chat, local support groups, and online services. Last year, Endometriosis UK supported over 50,000 people, but with 1.5 million people in the UK with endometriosis, we need to increase support, raise awareness, and end the silence and the stigma of it. Endometriosis UK have an amazing team of over 200 trained volunteers, all with lived experience, but they are looking for more volunteers as well. So the more people that can spread awareness is amazing. At the moment, they are doing this big Give Women and Girls Match Fund, and it starts in a week's time. It means that the match will be matched. So they're hoping to raise 20,000. That will be matched, and hopefully it'll be 40,000 that they can start to distribute across the UK. So let's hope that works. I'll be putting stuff up on Facebook, I'm sure of it. And then basically, I just wanted to say to anybody listening to this webinar that you aren't alone. Endometriosis UK is there. There are helplines, web chats, support groups. You can just go online and find out information. So you're absolutely not alone. There's ways around everything. And you can ask questions on Facebook. We have a local group where you can speak directly to us. There are other things if that's not available. But support lines, head over to endometriosis-uk.org, endometriosis-uk.org, and you find and there'll be this webinar on there, on there to help you through so that we can get in the right place, get you sorted and get back into your life again, because that's something that nobody should have to not be able to do. So I'd like to say a massive thank you to both Mr. Moran and Mildred. Once again, Mildred, it's just amazing that you're here, and all the time that you come to the support groups as well. This is stuff that people just don't know. You know, you attend Starbucks and talk to the women direct. It's just amazing the dedication that you all have that's outside of your job. So once again, thank you. Anything else you want to add, Kat?
No, I'll just echo what you said. Like, both, thank you very much and appreciate your time that you share with us. It doesn't go unnoticed.
Thank you very much, and I appreciate the the recognition. But I really love what I'm doing. So yes, thank you.
Thank you very much.